It is Central Valley Talk for this Thursday. We're live and local. Good afternoon. I'm Austin Reed coming to you from our Tower District studios inside the Mike Briggs building. It's 2:37, the 28th of October. Halloween is coming right up. Hey, my next guest joining us live in our studio today as we're looking at a shot of downtown Fresno. Let's see if I move this way. That's Chuck Chansey Park right there. So, Najeeb is with us. Welcome back. How you doing?
Good. How are you today?
Very good. Now, Najeeb is with KMY Prosthetic and Orthotic Incorporated here in Fresno. Where's your office?
6137 North Desta Street, Suite number 101B, Fresno, California, 93710. So basically off the 41 freeway, Bullard, and Fresno.
Oh, well,
yeah, right there.
That's where I live.
Yeah, right on there.
Wait, are you in that?
You know how there's a hospital, the surgical hospital right on Fresno Street? It's the next block over, right there.
Oh, how funny.
Yeah, so.
Now I can go. Now I can go into your office and say, "Hey, how you doing?"
Good.
I can come to you.
You're welcome.
Thank you, brother. What are we talking about today?
So first, I would just, with the holidays coming up, and a lot of people still have foot pain.
Yep.
And depending on, so Powerstep is one of the companies that sells orthotics through medical offices. So we all tend to have sales coming up, and just like everybody else, I just want to make my patients aware. They don't need prescriptions for these. These are off-the-shelf orthotics. They can come in, they're about $65 around there, retail. So, the more they buy, the more discount. Like a lot of us will buy one, get the other one 50% off, right? So, but they're just different ones. So what happens is people come in, we'll try on a couple of different ones because they have different way they control the foot. So as one way it might work on you, it may not work on the other person. So that's what we wanted them to do, is come in, and they can come in, no prescription needed. This is just a retail item.
Perfect.
So they can come in anytime they want. So we have 3 different styles, but bottom line is, with the holidays, these things all work well, and they're less than $100, so something affordable. And because custom orthotics, $500 plus.
Wow.
But they're made to you. These are pre-made, but they work well.
Okay.
And, if you don't have a lot of money, and we're spending a lot of money on holidays and limited whatever you have, so it's a one way to get something, and can be fit for you. So if you come in, I'm going to make sure it fits you, so you're not just buying blindly online or whatever.
Okay.
So that way we take care of the person the best we can.
So do you have like a program like a gift card or something? Or?
I don't. Okay. I don't have gift card because, we're the medical office. But we do sell these, just,
So, but somebody can just come in.
Oh, yeah, just somebody come in. No point. We prefer appointments due to still COVID protocol. But if they walk in, we're not going to say no to them.
Right.
So,
you'll help them.
Yeah.
Okay. The other thing we're talking about today is, this is very cool. It's called, is it OHI?
Ohio. Yeah.
OHI Fall Prevention Program.
Yeah.
So this is really a good way for seniors to not fall.
And that's what we're trying to avoid, right? So when people, one of the most common injuries for most elderly, not elderly, even young people in middle age, we slip and we fall. Only difference is when the elderly fall, they may break a hip or break a bone on the femur, and then they're out and about nursing homes, and everything, you hear about everything.
Yeah.
So the bottom line is we want to try to prevent that fall. So what I go around is myself aligning with another company here from Arizona. It's we try to talk to the doctors, primary doctors, as well as other PMRs in different fields. How can we help the patient make sure they don't fall? We want to catch them before they fall. And so the thing is, if the doctor's like, this is a questionnaire, just ask the person, have you fallen in the past? Okay. Do you have arthritis in your knee? Do you have ankles that are weakness? Drag your feet. So 5 questions. If they say yes, somebody picks it up, says yes, then they can more than happy to come in, and, we'll set up an appointment. They say if you've fallen once, you'll fall again, at least 50% chance more. And then they have, if they break their femur, their lifestyle changes. And so we're trying to prevent that. And the idea is, the more you can keep somebody moving and mobility, the better off they are. This is a whole line. And I mean, just like if you have parents, last thing you want to do is see them where they feel, whether it's true or not, they feel they're becoming burden on their children because somebody has to take care of them now. and they're used to play the role of care providers, and they hate to be taken care of. This is human nature, and so that's my only goal, is try to prevent that. And then if they have it, there's no charge for any of this. They come in, they can go over, and if the doctor recommends it, whether, we have a different pages here, but it's just a literature for the person, so they can take it. And then we do examinations. There's about 3-4 tests we do. There's a MPS fall risk assessment. There is the timed up and go, tug test, they call it, basically. Right. Can they go up and go? The balancing, and 30 seconds, can they get out of a chair without falling? And you'd be surprised how many people, as we age, just balance is a big issue.
Yeah, your body changes. I mean, This right here says 1 in 4 seniors aged 65 and older suffer a fall each year.
Each year.
That's a lot.
And then when they fall, the concern, like I said at the beginning, is either hip or femur fracture, big bone fractures. And then they change it. If they need replacement, we have a lot of people that age and they have arthritis already in the joints. The joints are weak, and so they break. And as a result, if they do, what we do is we want to try to put this type of brace on them. Okay. It's flexible, very light, and idea is it just helps to make them stable when they walk. And we put it on both feet.
Okay.
The idea is to give them balance on both sides, and you want to keep them lined up. And so this is the main goal of the object is prevent falls. Whether they are, we tell everybody maintain activity. This is normal for all doctors to tell everybody maintain activity, whether you do yoga, whatever you do, exercise, you maintain that. Exercise, mental exercises, physical exercises, stay as mobile as you can, because once you lose that mobility, it's hard to get back up. Yeah. And so this is the nature of human beings.
It's a very cool program, and with the holidays coming up. Oh, can you show me that shoe real quick before we go? Yeah. Tell us that.
So this shoe, because a lot of times when people get a brace, they have really narrow shoes, and so they don't want to, it's not going to fit my shoes, so it's not a problem. This company will provide a shoe with it. We can order it. Okay. So the idea is we know it's guaranteed fit. They're not going to have to worry about buying another shoe. Right. So we can get and it's nice thing about this shoe is Velcro, easy on the hands, and the heel can also be made snug because we tend to be wide in the forefoot, most of us. Yeah. But the heels are narrow. Yeah. So that's what this one does. So same company, same thing on that. But the main thing is just with the holidays coming on, be careful, wet weather.
That's right.
As you know, a lot of flooding, a lot of accidents, a lot of people did have injuries, and this is what we're trying to prevent. But we don't want them to be limited to homes, but we want them to be safe.
Safety first. Connect with Najeeb, medical doctor at KMY Prosthetic and Orthotic, Bullard and Fresno Street, Suite 10B. You're right on North Thesta. Right. North Thesta. So check out Najeeb before the holidays are here, and get a gift. Yeah. Could save that person's life.
That's it, and we want to make sure they stay healthy and out of hospitals and nursing homes.
That's right. We'll see you again.
Thank you.
Thanks for coming on. Appreciate it.
Anytime. Bye-bye.
All right. I'm Austin Reed. You're watching Central Valley Talk. We'll be right back.